Me, I should just check. All right, we are live. Hello, hello, everyone. Good evening, good morning, good afternoon, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas. If you're watching live, hashtag live, please, so I can give you a shout out. If you're watching a replay, also hashtag replay, so I can also give you an after show shout out. If you know anyone who will be watching this segment, please tag them, forward this link to them so they can catch it live. We will be taking questions live, so this is for you. And today we are going to be talking about what is an annual wellness exam. I get this question a lot, and it's an exam that's done every year, and typically with insurance it would cover. And it's an exam that helps improve your quality and quantity of life. So how well you live and how long you live. And so I'm excited today to be having a guest come talk about what an annual exam is, why you should care, why you should ask your doctor, if you're not able to come see us, why you should ask your doctor to have one done. And I'm excited to bring on, she's backstage, she's waiting, Dr. Giavonne Rondo. I'm going to pull her back up. There we go. All right. Hi, Doc. How are you?
Great. How are you? So great to see you.
Likewise.
Yeah, great to be here. I'm so excited.
Me too. It's an honor to have you on, Doc. I've been looking forward to having you on for a while. So thank you for agreeing to do this.
Thank you for having me. This is just amazing. I love it. I love what you are doing, Dr. Tulu. This is wonderful. Thank you.
Thank you. All right. So let's get right to it. We're talking about what is an annual wellness exam. But first, I would like you to introduce yourself, Doc. Who are you and what do you do, Doc?
Okay. Well, thanks again for having me, Dr. Tulu. I'm Dr. Giavonne Rondo, and I'm an internal medicine physician, and I am in Jeffersonville, Indiana. I've been practicing now. I can't believe I can say this, but I've been practicing now for over 22 years. And I have a business called GObile MD, which is a mobile direct primary care practice in both Kentucky and also Indiana. So, yeah.
Awesome. Doc, why do you do what you do? What got you started?
Well, gosh, I got started in terms of being in the field of medicine because I, like most other doctors, I wanted to help people. I specifically got started because my mother was very ill when I was in high school. And so I would always go to the doctor with her, and I just, got acclimated to the medical environment from that. Unfortunately, my mother passed as soon as I entered college. And I always kind of had that feeling of, gosh, what could I have done to really help her in terms of, living longer, living better. I ended up in medical school, and my dad had a stroke. And so it gave me that much more, I guess, impotence and the heart for helping other people as well. So yeah. And I'm an internal medicine physician, which basically means I deal with adults and no kids, so only adults. And so yeah. So pretty much my parents, my family is the reason why I got into the field of medicine.
Okay, I'm really sorry to hear about that, and I'm, in terms of what it costs you to get in this field. But I'm glad that you channel that into doing something for others, so they don't have to, maybe struggle the way your parents did somewhat. So, hats off to you. Now, we're talking about the annual physical exam. So, Doc, what is an annual physical exam, and why is that important?
Well, your annual physical exam is basically where you are going to your primary care physician and just from head to toe being evaluated, not only physically, but also psychologically or mentally. And it's super important because that's one of the ways that we as primary care physicians make sure that you are doing well, you're staying healthy, and that you're doing the things that are preventative as well as as well as just, taking care of just your overall general health. So not just going in when you're ill or when there's some acute issue going on, but going in and trying to make sure that you are doing the things that prevent disease and complications or problems when it comes to your health. And that's both physically and also mentally.
Okay. Can you hear me okay? Are you hearing me okay?
I can.
Okay. All right. Awesome. So you're making it, you're saying that an annual physical is a preventive. So it's not like you're going in when you're sick.
No.
You're going in and, once a year to check to make sure that things are going well with you and it's more preventive. But let's talk more about that. What are the typical components of an annual physical exam or test, say for an adult?
Okay. So for an adult, the way that I like to look at your annual exam, it's from head to toe, and it's from what I call from the front all the way to the back. And I mean that by saying, when I have someone coming in, when they first come in, when they're coming to the front office, we're looking at their logistics, their demographics. We're making sure that they're up to date when it comes to their phone, their email address, their insurance, if there's been any job changes. So that starts even before they even see the doctor. Then when they come back, actually with the medical assistant, they're doing their vitals, checking their blood pressure, the weight, their heart rate. And all those entities are important because it gives me a little bit of basic background in terms of, okay, what's going on in terms of some of their organ systems, even before I even, start seeing them. And then when they actually come back, we sit down and we talk about, hey, what's been going on over the last year, if they've been in the hospital, if they've had any acute issues, their family history, if any of that has changed. We do a complete physical exam, like I mentioned, from head to toe, starting with, of course, the vitals. And, looking into the eyes, listening to the heart, lungs, feeling the lymph nodes, listening to the abdomen. Just depends on what age you are in terms of doing a genital urinary evaluation, breast exam, and then just really, like I said, from top to bottom, really evaluating you very extensively so that we can pick up things that, may not be seen or, just make sure that you're
Dr. Rondo, can you hear me?
hear me?
Yeah, it looks like you're going in and out a little bit, breaking up a little bit, but we caught the depending on your age piece of it. I think that's the last time when I heard you. So it depends on your age, and you're doing an extensive exam, starting with their vitals, and you're doing front to back. Yes.
Depending on what we find, if there's elevated blood pressure, if there's a need to do blood work, we'll do those things as well, and that's added on to the evaluation. If you need to see a specialist for any reason, like say just
Dr. Rondo, did we lose you? Come back. All right, looks like we're having some technical issues. So while
whether you need a referral or
okay. Dr. Rondo, I don't know if you can hear me.
And then when it comes to prevention, we talk a lot about that. We talk about
all right, I'm not sure if it's her or me. Let's have internet issues. Let's see. All right. I think we're having a little bit of technical issues. For those of you who are watching, can you hear me? If you can hear me, can you say I can hear you, Dr. O? So I know if I think it's on her end, and we can continue the conversation. Can you help me out? Can you help me out here? Just put in the comment, Dr. O, I can hear you if you can hear me. And if not, Yes, it looks like we're having internet issues. So you can hear me. All right. So I think our guest is having some, so I'm going to take her off the screen just for a little bit. All right. So you can hear me. All right. So Dr.
I can,
Rondo,
yes.
yeah, we're losing you. I think there was a long piece where we couldn't hear you because I think your internet was not as clear. So we couldn't hear you for a good 2 minutes now. All right. You were mentioning, and I wanted to highlight this fact. When you come in for the annual, it is a preventive visit, is to check for things before they become an issue. So like you have a fancy new car, you don't wait for the car to break down. You don't wait for the car to break down before you go get
Absolutely.
it. You take it in, get your oil checked, but you are worth a whole lot more. And so
Yeah.
it's important to do this. And my guests are saying that you're breaking up a lot, so they're not hearing
You
you
don't
well.
wait for the car.
All right. Okay, give me 1 second. Let me see if I do that. All right. So I want to rehash some of the things she said because it's really important, even with the technical difficulties. So when you come in for an annual exam, there could be times where you're sent or you're referred to specialists. For instance, if you're over 45 years old, you're due for a colonoscopy or colon cancer screen. Different things to check for. And I have to be honest with you, a lot of people come in saying that no one told me this. I didn't know I was supposed to do this, or I've never had an annual or wellness visit or preventive visits, or why do I have to have the vaccines? But I have to emphasize this. Your insurance pays for an annual exam. They want you to get your annual exam because they want you to not have to cost healthcare dollars a lot of money, one. Two, they want you to get the things that would make you stay well longer. That's the issue. Okay. So that's why your wellness exams are very important. Okay. If you're a woman over 40 and there's no family history of breast cancer, having a mammogram, very, very important. I've had patients who come to see me in their 60s, never been told to have a colon cancer screen. And, right here, I'm not going to make it that's not, I don't want to veer off too often, but Black History Month, I'm going to be doing a live talking about some of the things that are common in our communities that we got to do better about. So these conversations are important because sometimes it's important that you know what is due you. All right. You're due an annual exam. You're supposed to get one every year. Preventive, check your vaccines, do your screenings, breast cancer screening, colon cancer screening, prostate cancer screening, the types of cancers that, if caught on time, can be treated. That's the whole idea. Now, I know I've had people say, Doc, hey, I don't want to find out some of these things. I don't want to stress myself. I don't feel pressure, so I don't have high blood pressure. Those are not true. You're going to have a conversation with your physician. You find out things before they become an issue. People don't have a stroke overnight usually. High blood pressure staying high and not detected for a while. People don't have heart attacks all of a sudden or go into diabetic kidney failure all of a sudden. Is things not caught on time? How many of you have gone to see your doctor and they told you you were pre-diabetic or your cholesterol was high and you did nothing about it? You were not told what to do. They just said it was high and that was it. All right. Our guest is back. So we'll continue the conversations, but you got the drift. All right, you're back. All right, welcome back. There we go. Okay, all right.
I am so sorry about that. I
No
apologize. I hope you can hear me a little bit better.
Yes. And,
okay, great.
I like the backdrop too. So the next question we're going to have for you is like, well, for someone who's wondering, well, I go, how often should I go for an annual exam? I already go see my doctor for all the chronic illnesses or for high blood pressure management. What would you say to that? How often should one go?
Yeah, just like the name says, just annually is perfectly fine for the most part. Now, if you do have, and so that's for your annual wellness visit or evaluation. So when you have that evaluation, you're not going in sick. You're not going in with an acute illness. You're going in just to kind of go from head to toe, dealing with anything that is more from a preventative standpoint, just to make sure that you are well and you stay well. So if there are issues that you have going on, like if you already have like an acute respiratory illness or urinary tract infection or you're having chest pain, that really needs to be during a different time frame. So the annual wellness just needs to be just once a year. just like the name says. And it's just to make sure that you're well. And because a lot of times in our visits, we only get 15, 20 minutes to deal with, basic little things in just a regular visit. But an annual wellness, hopefully you'll have a little bit more time. And that's a time where you can really focus on more preventative kinds of measures, like making sure that you've had if it's appropriate for your mammogram, colonoscopy, making sure that your blood pressure is well controlled, making sure that, let's see, if there's issues when it comes to your weight, more discussion about that, because we do know that there's, different issues that can occur when your weight is not as optimal as it possibly, can be. So just all different types of things. And what I like to do is I like to consider it, there's not just one, absolute way to have an annual evaluation, because everyone is different. You really have to individualize it. And it can be, not only the gender of the person, but also their age. It can be their family history. It could be different changes that maybe they've gone throughout the year in and of itself. And maybe you just want to kind of, as a primary care physician, you want to just kind of grasp, okay, what has this person been going through, not just physically, but also emotionally or mentally. Because as you know, Dr. Tulu, the mental health component is super, super important when it comes to just overall health. And I think a lot of times we kind of glaze over that. We focus a lot of times on just the physical, but the mental, and I'm telling you, maybe not just after, since COVID, but I feel it a little bit more since COVID, that the mental issues have really taken a front seat to a lot of things that are going on when it comes to people's health. So just having the time and the opportunity to talk about those things is super important. And that's why it's important to, to have an annual wellness exam with your primary care physician who knows you, and has records of you in terms of, all those things. So.
Awesome. Great point. Now, Doc, I'm going to ask you, what are things that you found out from those who come for an annual exam? Just to say, I'm here for my annual checkup. And I'm asking this question because I have some viewers who are like, man, I don't know if I want to go find out if something is wrong with me. I'd rather just, just live life, So what would you say to that? Like, what are things that you found just in having patients come in for their annuals?
Oh, man. A little bit of everything. Oh, well, as a matter of fact, I just recently, and I hate to kind of even, mention these things, but I have diagnosed about 4 cancers in people who actually do not come to the doctor. And several of them had not been to a doctor, get this, in 30 years. Mm-hmm. And so they had come in, actually, one of them was having symptoms. And so we just kind of did a full physical examination, asked a lot of questions. We did blood work, and come to find out does have a prostate cancer. Another young lady actually was coming in for her annual exam and had gained a little bit of weight, was complaining of a little bit of fatigue. So did the full physical evaluation, and she does have diabetes. And it's not always just, those types of things. Like I was mentioning before, there were some mental health issues that, we're kind of dealing with. So even though someone had come in and they were perfectly fine physically, they were dealing with grief. And so it was super, super important to talk about those things, to talk about depression, to talk about if there's any possible suicidal ideations, what they're doing now in terms of helping their mental health. And so for those individuals, their annual exam is turning into something that, okay, I can't just wait to see you in another year. I really need to bring you back in maybe a couple of weeks, just depending, or a couple of months. But yeah, that's really not something that I would just want to say, oh, okay, I'll see you next year,
Right. Right.
Yeah.
And for some people who are concerned about, the fear of finding out something bad, the whole idea is to find out information in time to save your life. That's the whole
Absolutely.
idea. The idea is not to find something wrong so we keep you calm. The whole idea is what can we do based on what we know in
Yeah.
science and to fix it so you can enjoy a better quality of life. So that's it. Thank you so much for those examples.
Absolutely.
Now, what are some common misconceptions about annual physical exams? So we can address them here. What would you say, Doc?
Yeah. So some common misconceptions is that, well, the doctor is always going to, come in with bad news, or that it's going to take a long time, or I'm going to be sitting in the office a long period of time. Or let's see, or that, let's see, the doctors just want to, just find something so that it just kind of pads their, income or whatnot. I don't know. So there's all different types of misconceptions. But really, the way that I look at, the health profession and just what we're trying to do is we want you to live longer and stronger, and being preventative and being getting ahead of something before it gets ahead of you is really important. And so I think that, and I think one of the misconceptions is that, doctors, they're just all about, you know, um, focused on just the bad things. But really, I love it when my patients come in and they have nothing going on, and
Yep.
oh, it's great, and and we can just kind of talk about other things, their life and things that they're looking forward to. One of the things that I started doing more recently within the last couple of years is I will ask people, what are their goals? Not just medical goals. What are your goals for your life? And so that kind of gives me a little bit more of a viewpoint of beyond the exam room. What kinds of things do you look forward to? What are your hobbies? What do you enjoy? Tell me about your family. So it's not just all about just that physical, okay, I want to diagnose diabetes and high blood pressure and have you coming back every 2 months or whatnot. No, I really do prefer maybe just to see you just once a year and that you're doing well. And maybe, we can continue that relationship for decades. That would be amazing. But yeah, there's a lot of different misconceptions. Yeah.
I love you.
I love you too. I do.
Oh my goodness. Like one of the questions I ask are, what are your health goals and how can I help you reach them? And as much as we love seeing our patients, and you can attest to this, like we enjoy the relationship and conversation, we don't want to have to see you often.
No.
Where the emails come, you're good. See you next year.
Absolutely. I love it. I love to see patients just once a year. I tell you, that gives me a relief. Like, oh, okay. I'm just like, I like to see my doctor just once a year. That's it. That is it. So yeah, and that's another thing too. I think that's a misconception, is that we doctors, we're above this, or we are people too. We should be taking care of ourselves as well. We should go to the doctor too. And I think another misconception is that you can't ask the doctor questions. I love it when my patients come in and they ask questions. And for the majority of the time, I'm able to answer the majority of them. But if I don't know it, I'll say just that. Well, you know what? I don't know. Let me get back with you. Or let me ask a colleague. Or, that's something that's, I really haven't dealt with. But ask questions. That is the one time, if you just go once a year, that your doctor should be able to, you should be able to ask any questions that you really, feel the need to, have answered. Instead of going to Dr. Google or, going online or whatnot, that is the time that this person who has spent a good majority of their lives and their education to learn about the body, to learn about health, to learn about wellness, to give it to you. So use them. Yep. Use your primary care physician well. So
use them well.
Yes.
We're asking for it.
Yes, we are. We are.
Now, for someone who's watching, like, okay, are there ways to prepare? You've alluded to some of this already, but are there specific recommendations or how patients should prepare before they make their annual physical exam appointment? What would you say, Doc?
Yeah, with that, one of the biggest things is come prepared with questions. maybe even look at the last time that you had seen the doctor. And if you have, been to the hospital or gone to the emergency rooms, get that information. Why did you go in? Your list of your medications. Questions, your list of your medications. Make sure that you're just prepared in terms of knowing about family history. So if there's some new diagnosis, like my brother was recently diagnosed with some medical issues. Well, when I go back to my doctor, I'm going to talk with her about those medical issues, not trying to violate any HIPAA laws or anything like that. But that's a first degree relative who is now having this issue. So those types of things are important. Let's see. So being mentally ready for that, being physically ready, it also depends. If you're a woman, you're going to be having a pap smear. That's something that you kind of want to get yourself ready for as well. With men, some men may have a prostate exam. I know that has kind of not necessarily fallen out of favor, but that's kind of controversial. There's some evidence that says that the risk of, the testing for the PSAs or prostate specific antigen is not as robust in actually doing the physical exam. You don't need to do it. So I think that's kind of up in the air. And I tend to still do some of those testing, but it really does depend if there's a strong family history. And then if there is, depends on the ethnicity, because African-American men do have an increased risk for prostate cancer. And so that's why it's important to kind of sit down, go over those things with your primary care physician. And I didn't think about this, but another good reason to go in annually is because things change. The guidelines aren't always static. So there's been guidelines that have changed the criteria when it comes to even something as simple as high blood pressure. So I like to really know. So I try to stay on top of, the literature and what is the recommended guidelines and what are the best practices, evidence-based practices. And so unfortunately that can change. So it's important for you to go in every year and be up to date with those same changes.
Yeah. Colonoscopies used to be when you're 50. Now it's 45.
Yep.
Screening.
Yes. And that's why it's super important to, like you were saying, go every year. Years ago, before they changed the age to 45, me and some colleagues were talking about how in African Americans that risk was higher. So years before the 45-year guidelines started up, I started treating for my African American patients more aggressively. In terms of looking at them at 45. And even now I kind of start at 40. So even at a younger age. So maybe I just tend to be a little bit more aggressive. But granted too, in my family, and then personally, I've, have some history of colon cancer. So I'm going to be a little bit more sensitive too.
Okay. Wow. Great feedback, Doc. This has been very, very helpful. So for someone who's watching, we're about to wrap up. Wow, the time went by quickly. Who's watching, who's like, yeah. I don't do doctors. I'm not sure. I hear you. Thank you for the feedback. Any words of encouragement to kind of help nudge our patients to make this a priority? Even for the person who's a little skeptical, who's like, man, it just sounds inconvenient.
Yes, I completely get it. And one of the things that I like to think of is that we're for you. We are consultants in your overall health and in your overall care. You are the CEO, but we are consultants. And so, but we can best help you if we know you and if we see you. We can't help you if you're MIA or missing in action or not wanting to come in. It's the same thing as, like, I use the analogy of cars. Your car runs best when it's well serviced, when it's evaluated, when you put good oil in, gas, of course, and make sure that the engine is running well. I'm not a car person, so my analogy is a little poor, but so it's similar to that. It's, we are the ones who, now you're the expert at you, but we can serve as consultants with your overall health and your overall care. And I know medicine is changing. And so it used to be this very paternalistic, okay, you do as I say, and that's it. But I consider it more of a partnership. I consider it that, you come in, you have certain issues or certain needs, or maybe you have nothing, and you just want to get that stamp of approval that everything is okay. And we can try to make sure that that is true. And if not, hey, we're there for you, so we're there for you, whether you're well, we're there for you, if you're ill, we want to be there for you so that you have, as optimal longevity of life, but also quality of life as much as possible. So, but I can understand how people can be, squeamish about going to the doctor. You get bad news, or you feel like, you're being judged, or there's just a lot of things. But I really like my doctor. She's very, very good. She's much smarter than me. And she gives me such wonderful feedback on what I can do to live a healthy and more optimal life. And I think it does change throughout the years. Like years ago when I was, much younger, it was like, oh, okay, let me just get through school, or let me just get this job. Let me just be in this position. But now that I am a mom, it takes a little bit of a different feel in terms of my own health, I can say personally. So, so that's another thing about having a primary care physician, is that they long-term, they can help you through those different changes within your life, whether it's your own body change, or whether it's, just changes that you're going through with your family. So that's the beauty of having a primary care physician and seeing them at least on a yearly basis.
I love it. Oh, this has been so good. This has been so good. I believe our viewers have been encouraged to at least consider going for the annual exam, and we've empowered them to know how to maximize that visit.
Yes.
Taking questions, asking questions, and engaging.
Yes.
And knowing that the doctors were not there to tell you what to do. We're here to consult with you and give advice on how to help you live long and well. I love it. I love it. So, Doc, people were wondering, man, this is awesome. I like this doctor. How can I connect with her? I know people who live not too far from where she is. Doc, where can people find you?
Yes, well, I am mobile, but I do stay within the Kentucky and Indiana areas. And it's called, you can look me up at GObile. That's www.GObile.com. So GObile.
GObile. She's also on the Instagram, right?
Oh, yes, I am on Instagram. I forgot about that. I am. And sorry, my daughter is my Instagram person. Let's see. So I have two. I have www. Wait a minute. Oof, I think it's GObile, but then it's also my name. It's Dr. Giavonne Rondo. So, yes. There you go. Thank you.
I got you.
How good I am in terms of social media. Oh, goodness. My daughter's going to be appalled. Okay, I'll have to show her this video.
You did good. This was so good. Thank you so much for coming. I have a lot of people who say thank you for coming as well. Thank you all for watching live and in replay. And for those of you who are watching, who are like, people who should listen to this video because you're concerned about them, just forward this to them. And people in the area, like Dr. Rondo is in, please also forward her information to them. You don't know who you could bless. But Doc, thank you so much for doing this. This was fun. We're going to do this again.
You are amazing, Dr. Tolulope. Thank you. Bye-bye.
Thank you so much. And everyone, thank you for watching. And as always, if you or anyone is looking for an awesome, a thorough family physician in the Mansfield, Texas area, even if you're not looking for one, or someone who needs a primary care doctor, please refer them my way. And if you know anybody who needs a good caring physician in the Kentucky area, where she is, please also share her with them. We make the world a better place, Doc. This is good. Thank you all for watching. Bye.
Thank you. Bye-bye.